Good afternoon, good morning to everyone from sunny Brussels. Thank you for joining us here today for an event dedicated to European Alpha-1 Awareness Day, a discussion on how to improve care for Alpha-1 patients. My name is Kinga Wojtowicz, and I'm extremely grateful for the opportunity to be able to moderate today's event. I'm a senior consultant at RPP Brussels. We are a healthcare consultancy, and we have had the privilege of working and collaborating with Alpha-1 Global for several years now. Before handing the floor to our esteemed speakers, I would like to make a few quick points. First, in terms of accessibility, we will be using an AI tool named Wordly, which translates speech into text in over 15 languages. We will now play a short video for our audience to let you know how it works and how you can try it by yourselves by following the link which was posted in the chat of this webinar.
How to use Wordly AI language interpretation as an attendee. First, click on whatever link or button your host has provided you. This will open up a tab in your browser for Wordly interpretation. As you can see, everything I'm saying is being captured and transcribed into English. We recommend resizing your browser so that it fits nicely along whatever video or slide content you have. Second, go to the language selector and choose any of 19 available languages that you would like to have the text translated into. Now, everything that's being said is being captured and translated into Japanese. If you have the right language accessibility pack, you can also listen to whatever is being said in your preferred language, simply by unmuting the speaker mic. And that's how you use Wordly translation as an attendee.
We really hope that this software will help more people to take part in the discussion and will help us bridge the language barrier. I would also like to encourage you to minimize the window of this webinar, as well as the window with the Wordly application. So you will be able to both follow the presentations as well as have the translation option as well. If you have any problems with the Wordly, please send a message to Anton Stoyanov, direct message. He will be able to help you with any technical issues. Another keynote that I would like to mention, as you have noticed, this event is being recorded and will be made available to other participants, as well as the public who are not able to attend, alongside the event report. In terms of participant interaction, you can ask questions throughout the whole event. The questions will be answered either in writing by our panelists or during the panel discussion later on. And one last final note before we start, when it comes to social media interaction for today and also after the event, considering that next Monday on 25th of April, we'll have the 5th annual European Alpha-1 Awareness Day. We have some Twitter handles for you, which you can find in the chat of this webinar. And these are #Alpha-1 and #Alpha-1Awareness. And with that, I would like to pass the floor to our esteemed hosts, members of the European Parliament, Marisa Matias and Isabel Wiseler-Lima. Ms. Matias, I pass the floor to you.
Thank you so much, and I want to welcome you all to this event. I'm sorry, my connection is not so good, so I'll try to improve as we are going through the discussion. But for this first moment, I just want to welcome you, really, and say that it's very important that we're organizing this event. This is, in fact, the second year that we are co-hosting such type of an event. We are here to listen from you all, to learn from you all, not to say much, but especially to learn, as I was saying. So we have been quite engaged in this topic, in the sense that we are working in several domains related to the problems which are raised to people facing this situation. And this is, I've been working in this topic for several years. Unfortunately, we didn't have the capacity yet to bring all the political measures needed to take care of the patient's rights and to increase the awareness. And so these events also help us to also find new models, new ways of trying to force developments in order to guarantee that the patient's rights and the awareness are achieved. So I don't want to take much time on this. I just want to say that we are here and available, and that we are hoping that at the European level much more can be done than it has been done until now, and that's why we are here, me and my colleagues. And so please try to use the time for just give us the opportunity to learn more. We know that the COVID crisis had huge impacts on everyone, and we know also that some groups of the population were much more affected than the others, and this is the case. So also, if we can reflect on the impacts and what we need to do and to bring to the floor in order to be discussed and addressed, I would appreciate a lot as well that we could discuss that. So thank you. I really don't want to say more because I want to save time, and then I'll be back in the end for some more deep and political remarks. But for this moment, I think that's enough. Thank you so much.
Thank you very much, Ms. Matias. Now I'm going to pass the floor to Ms. Wiseler-Lima.
Thank you, Marisa, for your introducing words, and thank you to the Alpha-1 patient community for the warm welcome. It is a great pleasure and honor, really honor, to once again be invited to host an event ahead of European Alpha-1 Awareness Day. And with each year, I can see and feel the progress that the community has made. Throughout the COVID-19 pandemic, Alpha-1 patients were among those that were especially affected. But with the onset of better times, we can take a step back and reassess the situation. COVID-19 laid bare many of the issues that were plaguing our approach to health, and with both the EU and its member states highlighting the importance of having resilient healthcare systems that can withstand the next crisis, we have to make sure that patients living with rare disease remain really at the top of the agenda. In the last few years, we showcased that we, as Europeans, can really accomplish much when we work together. And this is a lesson that we should take forward, especially when we are considering the changes that we'll be making to the way we approach healthcare. Tools that we already have on hand, like the Cross-Border Healthcare Directive and European reference networks, should be strengthened and made use of their fullest extent, not only by policymakers and experts, but also by patients themselves. On our end, we have concrete steps that we can take. The upcoming revision of the EU cross-border healthcare will give us, as policymakers, a chance to have a profound impact on how it can be used, expanded, and more notably advertised. I say this because awareness is key, not only when it comes to treatment opportunities, but also for early detection of conditions such as Alpha-1. And it is also why events like this are crucial. And allow me to thank here again all those involved in the organization of this event. They are doing an absolutely wonderful job. Thank you. As Marisa already outlined, I heard also that it is really one of the issues. Alpha-1 is vastly underdiagnosed and is difficult to catch at an early stage, both by healthcare practitioners and by patients. This is something that is common for other rare diseases as well, and is fortunately recognized by the European Commission, which has pledged to work on improving awareness and access to diagnosis for patients, as well as strengthening the research community. This will be accomplished not only through the revision of the Cross-Border Healthcare Directive, but also through the eagerly awaited proposal on the European Health Data Space and the upcoming integration of the European reference networks into national healthcare systems. I know it was really one of the main points we made last year and we were insisting on. But we should not stop there. It is on each and every one of us to play a role in strengthening Europe's response to rare disease. This is not something that we as members of the European Parliament can do alone. I'm very happy that the perspective of patient advocates who have already tried their best at influencing decisions will be presented, as well as the thoughts of the esteemed experts who are joining us today. Together, we can make change happen. I want once again to thank everyone who is here with us ahead of Alpha-1 Awareness Day, and would like now to pass the floor to Kinga, who will be moderating the event. Thank you so much. I'm sorry that I can't stay for the whole event, but my heart is with you.
Thank you very much. Thank you, Ms. Wiseler-Lima, and a huge thank you to you, as well as Ms. Matias, for your continuous support and engagement with the Alpha-1 patient community. Today, we are joined by patients, by clinicians, as well as academia, and we have a number of presentations on our agenda. When it comes to an agenda, let me just quickly walk through this. First, we'll hear from Mr. Scott Santarella, who is the CEO of Alpha-1 Foundation, and who will set the scene. Later on, we'll hear from Professor Jerry McAlvany, who will give some additional background on the disease. After a short video from Professor McAlvany, we'll also welcome Professor Chorostowska-Wynimko, who will speak about Alpha-1 and the European reference networks. Following the presentation of Professor Chorostowska, we will also have the opportunity to hear about the experience of Dr. Frank Willersin and Fernanda Aspie from Alpha-1 Plus Belgium. We'll hear from them about the activities and achievements in relation to patient outreach and patient advocacy at the national level in Belgium. At the end of the event, we'll also have some time for a panel discussion, during which our panelists will address questions that the audience will be asking throughout the event. And once more, to participate in this section, I would like to encourage our audience, our participants, to use the chat function or the Q&A box, which you can see in front of you. Now, I'm happy to present our first speaker today, Mr. Scott Santarella, who is the CEO of Alpha-1 Foundation and who will outline the priorities of the international Alpha-1 patient community and give us an overarching overview when it comes to the organization's work and future projects. Mr. Santarella, the floor is yours.
Thank you so much, Kinga, and welcome everyone. I'm Scott Santarella, and I'm the president and CEO of the Alpha-1 Foundation here in the States. Welcome to the 2022 Alpha-1 EU Awareness Day event. We are pleased you could join us, and we are excited for today's webinar in celebration of EU Awareness Day taking place on the 25th of April, 2022. I would like to thank our host for today's event, Member of Parliament Marisa Matias from Portugal and Member of Parliament Isabel Wiseler-Lima from Luxembourg. Both of you have been supportive of the Alpha-1 EU Awareness Day and Alphas in general in the past years, and we are grateful for your time today and for your ongoing support. I'd also like to thank today's distinguished speakers, Fernanda Aspie, Dr. Frank Willersin, Professor Joanna Chorostowska, and Professor Jerry McAlvany for taking the time to present to you today. Thank you to our partners, Kinga and Anton from RPP, for helping organize today's event. And thank you to all of our industry partners and organizations that support the Alpha-1 Global Program. Lastly, and most importantly, thank you to all the Alpha-1 patients. You inspire us to continue to serve you every day, and we're proud to do so. I'm going to walk you through a couple of slides now to give you set the stage, as Kinga said, for today's additional presentations. At Alpha-1, our global mission is to develop a collaborative global network of Alpha-1 patient leaders, physicians, researchers, governmental representatives, all in an effort to increase awareness, detection, and access to care for alphas around the globe. From this mission, 3 priorities to improve care of Alpha-1 patients have emerged. Number 1 is promote early diagnosis and optional access to care. Number 2 is raise alpha awareness globally. And number 3 is to facilitate stakeholder collaboration. And today is one of those days when we can start to do that. As we all are aware, improving diagnosis for Alpha-1 is essential, as there are thousands of undiagnosed alphas in the EU and around the world. As you can see from the graphic on the right-hand side of the slide, there's a cycle of negative events that occurs when an Alpha-1 is undiagnosed. Without proper testing and diagnosis, many of these individuals will go years without being properly diagnosed, leading to the deterioration of their health and, most importantly, their quality of life. Studies have shown that knowledge of one's condition early in life helps prevent one from engaging in activities that could exacerbate their condition. That knowledge helps one select the types of jobs one has or the location where one lives. Data also shows that there's a high financial cost when patients are not diagnosed. All of these factors impact EU members' healthcare systems, incurring enormous costs for misdiagnosing or underdiagnosing Alpha-1s, eventually taking the form or expensive organ transplants or expensive uncured disease progression. And that's why we're here today. It's our suggestion that the EU member states consider developing national testing programs for Alpha-1, as well as consider newborn screening as diagnosis methods. And we would like to help you in those efforts in any way that we can. Access to treatment, as I mentioned, is imperative for alphas. Augmentation therapy has extended the lives of alphas and improved the quality of lives of those patients across the globe. However, augmentation therapy is not available to most EU member states. We know that the cost is the main reason for its unavailability, a tragic reason since we know that augmentation therapy extends alphas' lives and improves their quality of life. In addition, individuals with genetic conditions should not pay higher health insurance premiums than others. The graphic on the right-hand side is the Alpha-1 Global EU's policy recommendations document. It is a standards of care document that states that Alpha-1 patients should receive augmentation therapy as soon as possible when there is evidence of lung deterioration. The Alpha-1 Global program raises awareness about Alpha-1 globally. We have Alpha-1 educational brochures in 10 languages that are housed on a dedicated Alpha-1 Global website. We have helped disseminate an infographic produced by an industry partner and patient organizations providing information about testing, diagnosis, and treatment, which is translated into 8 languages. And we are excited to witness the social media pictures and stories on EU Awareness Day on the 25th of April. The graphic on the right-hand side of the slide is from the Alpha-1 Global website. The website has a section represented by 50 country flags. When each flag is clicked, information about Alpha-1 in that country is shown. We are in the process of surveying country patient organizations to obtain updated information and to keep this information as current as possible. Alpha-1 Global also puts on events such as today's event to raise awareness about Alpha-1. There are a couple of other Alpha events on the horizon that I will describe in just a moment. Alpha-1 Global has been working with RPP to update the Alpha-1 patient advocacy training resource tool. Alpha-1 Global will be hosting an Alpha-1 patient advocacy webinar training on the 10th of May to launch this new pathway. The pathway will be housed on the Global website and will provide information, guides, tips, and suggestions on how to advocate. The new pathway has been updated for easier use and better engagement. The pathway will be helpful and useful for most basic types of advocates, being a self-advocate, to more sophisticated types of advocacy, including policy and legislative activities. We will put a link in the chat so you can register for the event, and we hope you all will join us on May 10th. As mentioned earlier, EU Awareness Day is April 25th. We hope you will share your pictures and comments on social media. Any way to spread awareness around the globe is of utmost importance. Alpha-1 Global and RPP will be sharing their activities on its own social media accounts. So if you're not already following the Alpha-1 Global's Twitter and Instagram accounts, we put the handles in the chat and you can follow us there, and we hope you do. As I mentioned, there are some upcoming Alpha-1 Global events. The Alpha-1 Patient Advocacy Webinar Training is May 10th, 2022. The Alpha-1 Foundation's annual national conference is June 8th, through 11th, 2022. That national conference will be broadcast online, so our global friends are invited to attend this national conference globally. More importantly, and more information will be sent to the global community over the next couple of weeks. And probably most excitingly is we are planning an international research conference and global patient congress in the spring of 2023. We have not been able to convene the biannual meeting since 2019 due to COVID, but we are excited and enthusiastic to begin the planning stages of this most important international conference. More information to come, but we plan to host the event in Ireland, and we hope to see all of you there in person. Thanks again to everyone attending today's EU Awareness Day event. A special thank you to our hosts, Ms. Matias and Ms. Wiseler-Lima. It's advocates like you and legislators like you that really can help us shift the paradigm of the healthcare systems within your countries. Your support is invaluable, and we really appreciate it. Thank you too to the speakers at today's events, which you'll hear from following my presentation, all of which are experts in the field. And thank you to RPP. We couldn't have done this without you. And lastly, thank you to all the industry partners and organizations that support Alpha-1 programs. We appreciate your support and your ongoing commitment to the cause. And lastly, and most importantly, thank you to all the Alpha-1 patients. Alpha-1 patients are at the heart of everything that we do. And at the Alpha-1 Foundation, we have a saying, if it's good for patients, we'll figure out a way to do it. So we're glad that you joined us today, and we look forward to the rest of the conference. Thank you so much for the opportunity to speak.
Thank you very much, Mr. Santorella. Thank you very much for your insights. Indeed, the work of Alpha-1 Foundation and Alpha-1 Global is truly vital for the patient community. And I would like to once more recall that in the chat of this webinar, you can find handles to follow Alpha-1 on Twitter. And we have also different handles for Facebook and also Instagram to follow future events. And I would also like to echo your Mr. Santorella's invitation to join this year's Alpha-1 Global Advocacy webinar, when we will give patient advocates an opportunity to get a better understanding of the tools that are at their disposal when it comes to influencing policy and also decision makers, both at European level as well as at the national level. Our next speaker is Professor Jerry McElvaney. Unfortunately, he was unable to join us live, but had the opportunity to share with us his expert opinion on Alpha-1 via a short video presentation.
What the customer wants, what they're intending to say when they do say something. So we're running that on every single second of every call that we get, every interaction that we get from our customers.
Wow, you nailed it.
Thank you for listening to me today. My name is Jerry McElvaney. I'm Professor of Medicine in the RCSI Medical School in Dublin, Ireland. And I'm going to talk to you about Alpha-1 antitrypsin deficiency as part of an awareness day for the European Parliament. Alpha-1 antitrypsin deficiency is a hereditary disorder, first discovered in Malmo in Sweden in 1963. Alpha-1 deficiency is caused by mutations in the Alpha-1 antitrypsin gene. Most common mutations are the Z and S mutation. They result in lung damage, liver damage, and skin disease. Unfortunately, misdiagnosis or non-diagnosis of Alpha-1 antitrypsin deficiency are all too common. The most common health problem we see with Alpha-1 antitrypsin deficiency is lung disease called COPD, or chronic obstructive pulmonary disease. COPD occurs in Alpha-1 antitrypsin deficiency because the Alpha-1 antitrypsin fails to get to the lung in sufficient quantities to protect it. The reason for this is that in the classic forms of Alpha-1 deficiency, the abnormal Alpha-1 protein builds up in the liver, causing liver inflammation and failing to get out in sufficient quantities to protect the lung. So in Alpha-1 antitrypsin deficiency, a number of bad things can happen. You can get very severe lung disease, often at an early age. This is called COPD or emphysema. This can lead to transplant or death. You can also get very severe liver disease, such as cirrhosis or sometimes liver cancer. And again, the treatments for cirrhosis are often transplant or death. And then rarely we see a severe skin disease called paniculitis, which in some cases can cause death also. Our goal is to prevent these outcomes. So what is the typical Alpha-1 antitrypsin deficiency patient? We used to think it was a male in the mid-50s, an ex-smoker, smoked a lot in the past. But by the time this person came to notice, their lung function was quite impacted upon. They had emphysema in their lungs and had evidence of liver disease. And the unfortunate fact was there was an enormous delay in diagnosis of at least 9 to 10 years from symptoms to diagnosis. We know a lot more now. Typical Alpha-1 now, maybe this young child here, diagnosed at birth, or these individuals here. So depending on the classic phenotype, the classic presentation for Alpha-1 still leads to misdiagnosis and underdiagnosis. We have to have a broader approach to the diagnosis of Alpha-1 antitrypsin deficiency. So we in Ireland are doing that. We test for Alpha-1 antitrypsin deficiency in a number of different ways. So if you have low levels of Alpha-1, we will get that blood sample sent to us and we'll test for the Alpha-1 antitrypsin deficiency genetic defect. We also have a screening program. So everyone in Ireland with COPD or poorly responsive asthma or liver disease or paniculitis, a skin disease, or indeed a first-degree relative of a person diagnosed with Alpha-1 has a right to be screened for Alpha-1 antitrypsin deficiency, free of charge. To date, we have screened over 25,000 individuals. Some of these people have COPD, some have liver disease, some have asthma. But we've detected quite a large number of people with Alpha-1 deficiency from this group. So in fact, of 25,000 people tested to date, over 1/3 have at least one abnormal Alpha-1 gene. The majority of these people have what we call a ZZ gene. That's the severe form of Alpha-1 deficiency, about 417. But we've also a lot of people who have an MZ form of Alpha-1, over 4,000 diagnosed. And we've learned more about the MZ form of Alpha-1 and the SC form of Alpha-1 over the last number of years. So we know that this targeted detection works. And to just go back again, we are following ATS, American Thoracic Society, and European Respiratory Society guidelines. And again, we test all COPD patients, all non-responsive asthmatics, all people with liver disease of unknown origin, all people with paniculitis, and first-degree relatives of Alpha-1 patients. So these people are offered free testing, and we've discovered quite a lot of people with Alpha-1 antitrypsin deficiency. This is important because, again, Alpha-1 is a genetic disorder. For a person to get Alpha-1 antitrypsin deficiency, they must get it from their parents. We used to concentrate a lot on the very severe form of Alpha-1, the ZZ form. To get the ZZ form of Alpha-1, get a Z gene from both your mother and your father. If a person with the MZ form of Alpha-1 had a child with another MZ individual, there's a 1 in 4 chance that the child will be a ZZ. But there's also 1 in 2 chance that the child will be an MZ or carrier. In the past, we tended to think of carrier status as just being that. You carry the gene, but we're not affected by it. But now we have increasing data that being an MZ carries a risk of itself. So a study performed in Ireland with colleagues in Harvard and sponsored in large part by the Alpha-1 Foundation managed to show that people with the MZ form of Alpha-1 now had an increased risk for COPD if they smoked. In fact, the risk for COPD in MZ smokers was 5 to 10 times that above normal. They had lower lung function if they smoked than an MM individual, a control individual, who smoked the same amount. This is the first time we showed this. And it was important because it started to explain why some people are more susceptible to COPD than others. Now we're detecting more and more people with the MZ form of Alpha-1 and finding that they had this increased risk for COPD. We found a similar increased risk in people with the SC form of Alpha-1. But again, we found an interesting observation. People with the SC form of Alpha-1 who did not smoke had no increased risk for COPD, as you can see in the slides on the right. However, if an SC individual smoked, their loss of lung function was greater than an MM individual who smoked the same amount. So now we are starting to understand that alpha-1 antitrypsin deficiency is not just ZZ individuals with severe form of deficiency who are at risk, but MZs and SCs and other rare mutations are also at risk. So now we know from a lung point of view that people with the ZZ form, they've received a Z mutation from both parents. They have severe deficiency and a significantly increased risk for lung disease, even if they don't smoke. An SC individual will have significantly increased for lung disease if they smoke, and also an increased risk for liver disease. MZ individuals have an increased risk for lung disease if they smoke, and an increased risk for liver disease. So now over the last number of years, we've started to hone in on what the risks are in alpha-1 antitrypsin deficiency. There's another risk. We know that a child from a smoking family is much more likely to be a smoker than a child from a non-smoking family. So there's a double hit for the children of alpha-1 smokers. They inherit the genetic risk and the social risk. So a double hit of having a genetic abnormality or genetic predisposition and smoking. And there may be a treble hit. We know that people with alpha-1 antitrypsin deficiency who smoke and work in certain industries where they're exposed to vapors, gases, dusts, and fumes have an increased risk for lung disease also. So again, over the last number of years, we've started to realize how this condition works. Put it in context, there are approximately 20 million MZs in Europe. In addition to the lung disease, we're now finding more about the liver disease risk. So we know that people with a Z allele who carry a Z gene, even if it's an MZ or an SC, have an increased risk for liver disease compared to their MM counterparts. And the risk is made worse when they get a second hit. So for example, if they drink a lot, if they drink a lot of alcohol, or if they have a lot of fatty liver disease, they have an increased risk. So diagnosis is extremely important. Are there specific treatments for alpha-1? The one that's most available at the moment is giving weekly intravenous infusions of alpha-1 purified from the plasma of MM individuals. This has been approved by the US FDA since 1987. And a study performed by ourselves here in Europe and with our colleagues in the US and Canada showed that this therapy works. Weekly infusions of plasma purified alpha-1 slow down progression of emphysema. And this is undoubtedly one of the major breakthroughs in alpha-1 treatment over the last number of years. However, it does not stop progression of emphysema, it just slows it down. And this type of therapy is not readily available in many European countries, including my own in Ireland. Are there other therapies that might be useful? There are. We're now looking at oral neutrophil elastase inhibitors, and they may be useful as well in helping the lung disease. And maybe also the liver disease may be helped if you knock out the Z gene in the liver preventing it from polymerizing and causing liver inflammation. The best of all possible treatments would be to get the Z alpha-1 protein out of the liver and into the bloodstream, where it get into the lung and protect the lung. And that is presently being evaluated at a clinical level. However, what we need to do first is diagnose Alpha-1. We've been singularly unsuccessful in diagnosing Alpha-1, both in Europe and in North America. It is reckoned it takes 5 doctors 7 years to make a diagnosis. What we have to do is be aware. Alpha-1 antitrypsin is the classic biomarker for COPD. To measure the levels of Alpha-1 is easy, and we know who we should look for. We should look at people with COPD, poorly responsive asthma, cryptogenic liver disease, paniculitis, and first-degree relatives of people diagnosed with Alpha-1. And once we make the diagnosis of COPD, we should test for Alpha-1. And once we make the diagnosis of Alpha-1, we have a whole host of things we can do. We can stop people smoking. If we do nothing else, that is a major, major deal in Alpha-1 antitrypsin deficiency. We can screen their families, pick up people with Alpha-1 antitrypsin deficiency before they get significant lung or liver disease. We can give genetic counselling. We can tell people what the risks are, because we now know more than ever what the risks from Alpha-1 antitrypsin deficiency are. In some cases, we can get people into pulmonary rehabilitation. In others, we can get their liver assessed. We're getting better at doing that all the time. We can get people reviewed in specialized Alpha-1 clinics. And this is something that's happening more and more. We're now realizing that people with Alpha-1 deficiency should be seen in specific Alpha-1 clinics. And we can get them enrolled in clinical trials. Clinical trials are important because we know that the newer treatments that we think may be effective for Alpha-1 need to be proven in a clinical arena. I'd like to thank you for your attention, and I'll end by saying that the idea of targeted detection is very good, and yet we still are underestimating the amount of people with Alpha-1 antitrypsin out there in the European Union and in North America. It may be time to consider neonatal screening, or at the very least extending our targeted detection programs throughout the EU and North America. Thank you very much for your attention.
Although he was not able to join us today, we would like to thank Professor Macalvini for his expertise and for his time to provide us with a very valuable contribution. I'm certain that his knowledge and expertise on Alpha-1 are greatly appreciated by our audience today, and they gave those of us who are less familiar with the details of the disease an opportunity to peer behind the curtain of science. I would like to right now to present our next speaker, Professor Joanna Chorostowska-Wynimko, who is the lead of the Cross-Border Care Committee of the European Reference Network Lung. Professor Chorostowska is also the coordinator of Central Eastern European Alpha-1 Network, coordinator of the Alpha-1 Antitrypsin Deficiency Registry, and the Polish Alpha-1 and the head of the Polish Alpha-1 Antitrypsin Diagnostic Lab. Due to other commitments, Professor Chorostowska will not be able to join the entire panel discussion. Therefore, I would like to encourage our audience and the participants of this webinar to table any questions they may have as Professor Chorostowska-Wynimko gives her presentation. Professor, the floor is yours.
Thank you, Kinga. Thank you very much for the invitation. As always, I'm very honored and happy to be part of the actually any event linked to Alpha-1, building Alpha-1 awareness. You have heard that my role within Alpha-1 community is well, actually I am Alpha-1, very much Alpha-1 in heart, And I am also happy to be part of the ERN lung network in Europe. As you know, this is the effort and activity that hopefully would allow us to be much more efficient in terms of diagnostics and treatment of patients with rare diseases, lung rare diseases, and that of course includes as well the Alpha-1 antitrypsin deficiency. I would like to start my presentation with the slide that I have already shown you a number of times before, because this slide actually represents the statement, the expert statement published in 2017. And I think it's important to emphasize that the aims that we identified 5 years ago are actually still aims that we are targeting or looking at now. Coordinating EU policy was an important task at that time. It still is. However, I'm also happy to say that ERN lung, to a certain extent, have been created in order to meet this this aim, harmonizing standards, benefiting patients, but also healthcare providers from differential expertise. This is something that we at least partially achieved within the ERNs, within the ERN lung, and within Alpha-1 core group, and I will be very happy to share with you our experience. I also hope to share with you some challenges that we have met on our way, and that we would be very happy to discuss with the policymakers, because in my understanding, without actually identifying those challenges, it would be very difficult to move forward efficiently. Of course, the ERN lung network is dedicated to a number of rare respiratory rare diseases, and Alpha-1 antitrypsin deficiency is one of them. I do not wish to say only one of them, but I must say that there are problems and challenges that we are sharing with other core groups, but there are some that are very specific to Alpha-1 antitrypsin deficiency. One of the major challenges faced by the rare diseases, and this is per definition, is actually allowing for or actually achieving the best or the acceptable representation of European diversity. And by that I mean, of course, the diversity in awareness, diversity of the healthcare delivery to patients, both to those who have been already diagnosed, but many who have not yet been diagnosed. This is true for any rare disease. This is also very true for Alpha-1 antitrypsin deficiency, as mentioned by previous speakers. So the problem that ERN lung is struggling with is actually ensuring the optimal representation in terms of the geography within Europe, and in terms of ensuring a good balance between different parts of Europe. On this slide, you can see that we were not entirely successful, and this slide represents the ERN lung network as a whole. And I think it's easy to see that there are certain parts of Europe that are much better represented than others. And of course, it's not about representation per se. It's more about really truly ensuring that all European patients are actually embraced or included into this expert network, and that I think that this map shows that there is still a lot to be done. This is, on the other hand, the map of the Alpha-1 core group, and you might appreciate that there are some issues here with the coverage of the complete European or whole European population as well. We are moving forward, though. We are a number of centers involved indirectly, I would say, and this is one of the challenges, one of the problems that we have been facing from the very beginning of the ERN lung network. We have a number of full members, of affiliated members, as well as supporting partners. The problem with ERN structure is that the center, the center that's applying to become part of the ERN lung has to meet a certain requirements, about competency requirements, as you can see here, but also requirements in terms of the healthcare provision to the patients, as shown here. It happened, or it proved to be a problem for a number of clinical centers that are not as experienced with alpha-1 antitrypsin deficiency. And you can imagine this is true for the regions or countries that are in great need of actually having the expert center, or at least a center that aspires to become an expert center in the future. That means that we have a number of centers that cooperate with us, that are so-called point of contacts, but not in terms of administrative point of view, part of the network. It truly makes it difficult to embrace those centers and allow them to the full access to all the tools that have been developed for ERN networks, and I will come to that later. The problem here also actually is due to the fact that while the ERN networks have been founded by the European Union, or I should rather say have been developed by the EU administration, the funding was scarce. And you might imagine that for the clinical centers, at least for some of them, it proves actually the funding on all those requirements proves quite difficult. So without funding, it has been very difficult to move forward, and I do believe that hopefully in the future the policymakers would take this fact into account and actually help us in funding as well. So as has been already mentioned, there is a number of challenges directly linked to the alpha-1 antitrypsin the deficiency per se. And what we have been working on and trying actually to move forward in recent years within the ERN lung and the Alpha-1 core group, but not only. We have been cooperating with EARCO, as you know. We have been also cooperating with the ERS to achieve success. But what we identified as key challenges was the Alpha-1 diagnostic provision in Europe. It has been mentioned today that actually the number of non-diagnosed Alpha-1 patients in Europe is huge, and this is definitely a challenge that we have to understand better and we have to work on. What we have identified as a problem within the ERN-Lung from the very beginning was actually access to testing for Alpha-1 antitrypsin deficiency, but in parallel also access to the good quality testing. And this is why the idea of the laboratory diagnostic harmonization has been born. Essentially, we created a network of laboratories now, certified laboratories, thanks to the harmonization that have been represented within the ERN-Lung Alpha-1 antitrypsin core group. This, as you know, has been started by 2 labs, Warsaw and Pavia, as a core labs. And now we have a network of cooperating labs that have been part of this group for a few years already. And this more or less covers the major European laboratories that have been involved in Alpha-1 antitrypsin deficiency. But as well, it showed us that testing standardization throughout Europe is of crucial importance. We have identified throughout this project a number of important issues that have to be addressed, and one of them is actually developing a program of European external quality control for Alpha-1 antitrypsin diagnostics. Not only genetic, but as you know, part of the diagnostic involves also the phenotypization and quantitative meaning of the protein per se. So what we would like to develop in coming years is the ongoing European program, open to all laboratories, essentially to any lab that would be interested in obtaining the certification and making sure that they provide a highest quality diagnostics. Then the clinical care as well, and it has been mentioned that we are on the learning curve, still on the learning curve with Alpha-1. And that means that we need data. We need data in order to understand the disease much better than we do now, to understand it, how it develops, and also to what extent the treatment we have and we hope to have changes the natural history of the disease. For that, we have started in cooperation with the ARCO, the Clinical Research Collaboration Network, funded by the European Respiratory Society, the European longitudinal European Alpha-1 antitrypsin registry. This is absolutely important. We collect and have this data to be analyzed. That also means that we are working on and need to work on broadening the cross-border clinical cooperation. There is a number of issues, legal issues, healthcare organizational issues, awareness issues that actually hamper the cross-border cooperation from the point of view of the individual patient. But in the meantime, we have been developing and working on the cooperation between the clinical centers. As you know, the ERN Lung, where the ERN developed certain systems that have been created to allow to push forward the clinical data exchange, clinical patient management system, which proved to be very helpful. However, the problem with the CPMS is that is for the moment available only to those healthcare providers that are within the ERN network. As I explained, the criteria, the requirements actually ensure that the centers that have been involved into the ERN Lung are mostly very experienced centers. And the data exchange, although important, is not as crucial as the data exchange between experienced and not so experienced centers. So this is a huge unmet need that we have been informing the EU about, because the CPMS has been developed by the Brussels administration, and there are promises that it's going to be reworked in a way to become more open to the other clinical centers. But for the moment, this is, I think, one of the biggest problems that we are facing. We are struggling. Some technical issues that have been also quite painful for us at the beginning has been worked on and disappeared. But actually ability to share data with other colleagues is a major issue. Of course, in terms of the cross-border, the referral and also the issue Europe is very diverse in this regard, and here we very much need help from the policymakers, from the government as well. So the national plans that have been mentioned are actually quite important in this regard, but also harmonization of the national plans and inclusion of the cross-border referral within the national plans would be extremely helpful, because for the moment I do see a number of barriers that are very difficult for the healthcare professionals to cross due to the politics, to the funding and healthcare organization. And then finally, two issues that are part of our activities within the ERN Lung Alpha-1 core group is education. We are currently working on the e-learning modules for healthcare professionals, on the workshops, programs that would be dedicated to, as I said, to healthcare professionals, clinicians, specialists, but also GPs. I think that it would be great if we, together with patients, work on some modules dedicated to the patients, because I do believe that a lack of awareness or essentially awareness should be our major target for the moment, and there are many groups that could be actually target of this educational tools that we could develop. And finally, meaningful patient involvement. As you know, patients are part of the ERN Lung network and part of the Alpha-1 core group. Other core groups have already developed so-called patient journeys. Alpha-1 is to be developed, and I'm looking forward to working on that as well. And finally, I would like to emphasize the need for the national plans. This is something that we addressed in the expert statement in 2017. And this is actually, I think, one of the major issues that we should also target now and in coming years. Thank you very much for listening to me, and I will be very happy to respond to any questions.
Thank you very much, Professor Horostowska. Thank you for providing this overview of European reference networks, and also for presenting challenges that you see as you're involved in the work of the networks at the European level. I would also like to encourage once more our audience to ask questions in the chat section or in the Q&A box. And at the beginning, maybe I would like to also take this opportunity to ask a question that is of interest also to me. You mentioned that the European Commission was key when it comes to establishing the works of the European reference networks. And this is also something that one of the biggest achievements of the European Commission of the European Union in terms of when it comes to healthcare. And we know that over the last months, the European Commission raised the point about strengthening European reference networks and expanding the remit. As a key figure when it comes to ER and lung, what do you believe are really the concrete steps that should be undertaken to achieve these goals?
Well, thank you very much for this question. This is truly a very important question. So I mentioned the funding. I think we all understand that without the funding, it has been difficult to build the efficient network, and in some regards we were not successful, as shown, for example, by the geographical spread of the network. So, actually supporting the ERN networks, not only lung, but also other networks with funding would prove very efficient. I do believe that at least part of the funding should come from the national levels as well, because strengthening the national expert centers is absolutely crucial. You might have noticed from the map that are the big parts of Europe, of European Union, that actually are not very actively participating in the ERN lung per se as a whole. And I think that very much speaks for the need of the financial support from the specific governments and EU per se, but also what I would call as administrative support. At the very beginning, we actually seen that in some countries, and that was true for both Western and Eastern, Northern and Southern European countries, there was a lot of confusion within well, let's say the governmental agencies on how to actually accept or endorse the given center to become part of the ERN. And that caused a lot of problems. So I do believe that more active involvement of the national policymakers would be very important here as well. Essentially, I would say a more harmonized effort from the European and national level.
Thank you very much for this insightful answer. We also have a couple of questions from our audience, so I'm going to move to these. Our audience would like to know more when it comes to e-learning modules, and what do they include? Would you be able to give a brief overview?
Well, we are working on the modules, so I am not actually ready to discuss in much detail. Nevertheless, what we intend to do is to build the modules dedicated to diagnostic per se, to actually help clinicians to understand better what really a a comprehensive Alpha-1 diagnostics means, but also whom the diagnostic should involve. So as Professor Michael mentioned, this is nothing actually new. We have been having guidelines for years now. Still, majority of COPD patients have not been. Still, the family screening is not provided properly. And I do believe that understanding of what genetic counseling implies is absolutely important. So the diagnostics, but also treatment. I think there are many misunderstandings in regards how to provide a proper care, clinical care for patients with diagnosed alpha-1 antitrypsin deficiency, severe, but also a moderate, so heterozygotes, and of course, not only pharmacological treatment. I think we have been very much focused on pharmacological treatment, but it's not all. It's also rehabilitation, it's prevention, and I think so. There are many aspects. It's the clinic of the alpha-1 antitrypsin is rich, and we have to really make sure that awareness about the complexity is there. Thank you.
Thank you very much, Professor Rostowska. Keeping in mind the agenda, we have time for one additional question. When it comes to other questions, I would like to mention to participants that we'll get back to all of you in writing post-webinar, but we still have time for one question. So Professor Rostowska, one of the participants has a specific question when it comes to the cross-border healthcare directive, which, as you know, is currently under review by the European Commission. So the question is, what are some of the key things policymakers should be focusing on as they work on this directive in order to achieve the best possible results for citizens and in particular alpha-1 patients?
Well, I think I mentioned it in my presentation. So the major issues, the major difficulties we have been facing over the recent years is the diversity in healthcare systems. Also the administrative barriers for patients, the number of paperwork and well, I think the barrier is the best way to explain it. It's very difficult for the patient. Patients should not be bothered by such problems. It should be actually automatically solved within the system. So I think this is the major issue. Then, of course, the funding or financing of the cross-border care delivery. It's also a problem. It's not also very diverse within Europe. So another word, again, harmonizing in between the EU countries would be extremely helpful. I think doctors should do what they do best, so care for patients. Patient should not be bothered by the paperwork and administrative issue. That should go to the people who are professional in that regards. Thank you.
Thank you very much, Professor Rostowska-Winimko. Thank you once more for joining us today and for your invaluable contributions. We really appreciate the time that you devoted to speaking with us. And if you're still with us during the panel discussion later on, we are certain that there will be more questions for you. And in the interest of time, we can move to another section, which is a short video presentation made by our patients from Belgium, who will speak about their activities at the national level, their policy efforts in order to improve the situation of alphas in Belgium. We'll play a short video because unfortunately they could not join us today.
Well, for me, it was a question of how to say education of democracy, because in 2013 I was invited to the parliament as a visitor. It was a session about rare diseases, and during the afternoon, where there were so many themes and discussions, I realized that people from outside like me could get in there and speak with our policymakers. And I thought that was fantastic and to do, because I knew about my rare disease, Alpha-1. And so from that point, I started to open eyes and ears to contact them and to do some work with them.
Reaching out to the Belgian policymakers, specifically in this topic about the access to augmentation therapy. The first step that we needed to take was indeed to identify, which is something that in Belgium is not that easy, because the health matters and health in general, the competitions of the different governments in Belgium are different, and it's difficult to navigate and to understand who is doing what. But it was following an event that we had specifically where we were invited to by one pharma company to an event they organized, and they had invited also some policymakers where Frank and I started to realize, okay, who is the ones we need to talk to? And then also discussing with our colleagues from Radior, which is the umbrella association for rare diseases in Belgium, because they do have contacts as well with policymakers. So we started to understand better who were the persons that we needed to meet. And then in parallel, we were ourselves, there was one specific person, a member of the Belgian Parliament, who reached out to us directly because she was very much interested in rare diseases, and she is working in the Health Commission at the Parliament, and she's also doing a lot of work around orphan drugs, and she was interested in what was happening with Alpha in Belgium. So then, of course, we needed to prepare for that meeting, and me personally, I've never discussed with a politician, so I remember that at the international Alpha-1 event that was organized in 2021, that Randall and the team were discussing about the pathway for advocacy. So I contacted Randall, and Frank and I, we had some discussions with them, with him and his team, and they helped us to prepare the discussion with this Belgian member of parliament.
So discrimination is the most important point, because why Alpha can get treatment in Germany or in France, but not in Belgium. And this is unacceptable. And of course, this is the kind of motor, of power engine, why we are working. Of course, there are also a source of energy coming out from the next generation, because all our work is going for the next generation to have a better life than we have today with Alpha-1 in Belgium. And so this main message, of course, is a kind of shield, and then there are action plans and arguments. But you have to know that to create awareness in a society where 500,000 people carrying a rare disease out of 11 million inhabitants, well, it's not so rare, they are quite often. And to create awareness about this kind of discrimination is the most important thing and the most important message.
In Belgium specifically, we do have the problem that we cannot, all of us, get treatment, get access to augmentation therapy. That is one of our key problems. But there are other problems that we do have in Belgium and in other European countries, and that are problems for Alpha-1 and also for other rare diseases. In Alpha-1, for example, we have it's a disease that is underdiagnosed, and for me, this is something that needs to change, and it's very linked to awareness, like Frank was mentioning. In fact, being diagnosed is very important because it allows you as a person to take measures to change your lifestyle and to improve your quality of life. And it's extremely important, even if you do not have the access to the right treatment, with doing a lot of things yourself, you can change your life and have a much better life than if you don't know what you have. So it's really key to have more awareness and to have much more diagnosis across the countries. Then, of course, the issues about the access to the treatment. And then a third very important element for me is, and it's something which is common with other rare diseases as well, is the fact that we are lacking a multidisciplinary approach for many of us. And Alpha-1 is a disease that impacts, it can impact your lungs, it can impact your liver, it can impact your disease, it can have impacts on other problems that you can have, health problems. So for me, this need to have this multidisciplinary approach to take care of all of these physical issues that you may have because of your disease, and also even psychological issues that can also have. It's very important, and it's something that we certainly need to work on as well. And how to address this? For me, it's we need to have more. We need to make our health system stronger. There needs to be a lot of things being done at European level. I know that Eurodis is also fighting for having a European plan for rare diseases that can then translate into different member states. This is extremely important. For Alpha, something that is very important as well is all the legislation that needs to be revised around plasma, because we certainly need to improve the plasma collection in Europe to help people with Alpha-1, but also patients with other diseases as well.
We are in a landscape of communication. And so I think to measure awareness or to measure outcomes is quite difficult. We have to sensitize, and in a certain way, there is one feeling which is so important for us, because we have the idea that things are going further step by step. And that means our network is getting more and more important, not only with Alpha-1 patients, but with all the stakeholders group in this landscape of communication. And so, for example, to get a question to the Prime Minister about Alpha-1, of course, that's extraordinary. We never dreamed about that, and but it's not. Of course, it's a success. But the whole thing is to stay in the boat all together and to go step by step to a horizon which is coming up quite fast. And in the next year, things will change in a very good way. Well, together we are stronger, and that is important, because in a rare disease there's not so many who are in action, and so we have to stay together with all the associations. And one advice is to build up the network more and more in communication with all these stakeholders which we have in the landscape of rare diseases of Alpha-1. And so one level is the national level, to stay in contact with the Rare Disease Association in the specific country is quite important, but also to stay in contact, for example, with the Association of Patients with Immunodeficiency or with hemophilia, because they also have some problems, like, for example, plasma donation, and they are in the same kind of patient groups on different levels. On the international level, of course, association like Eurodis for the rare diseases is quite important, but also ERN Lung, which is the European Reference Network for rare lung diseases, or ERN Rare Liver. And don't forget, the European Lung Health Group. The European Lung Health Group is a group with members of the European Parliament. There are more than 20 in, and perhaps here in this meeting, our members of the Parliament should join this group, the European Lung Health Group, but there are also doctors and there are also patient representatives from rare diseases, but also from other lung diseases like tuberculosis.
Well, looking at my own experience, I would say, go ahead, you have nothing to lose. Get help. People like Alpha Global can help to prepare the discussions. People from associations from other countries that have gone through it can help to prepare the discussions, and there is nothing to lose and a lot to gain, I think. So preparation is important, and there are tools that we have. And then, of course, what is important as well is to try to keep going and to keep the dialogue going with the policymakers. It might not be easy and it might not pay 100% results the first time, but it's very important to keep the dialogue with them, because ultimately it's them who can change things.
Although Frank and Fernanda could not join us today, again, I would like to thank once more for the time and sharing their insights. I'm certain that their perspective will be also useful and valuable for the policymakers in our audience. I'm aware that also a lot of patient leads, patient advocates across the EU join us today. So if they have any questions, if you have any questions for Frank and Fernanda about the activities, please feel free to contact Alpha-1 Plus Belgium. I'm certain that they will be happy to answer any questions you may have. Now I would like to welcome all our speakers to a panel discussion during which we can answer questions that we received from the audience in the meantime. So I would like to ask everyone to put their camera on, and also welcome Randall Plant, who will also be part of this discussion. Maybe we can start at the beginning with one of the last questions that we received from the audience about the main barriers to augmentation therapy in Europe and how they can be successfully solved. So maybe Randall, would you be able to address this question right now?
Sure. Well, augmentation therapy is approved by the EU Parliament, and unfortunately, the barrier lies within the national countries. It's a reimbursement issue. And so, advocacy is really an important component to be able to move the needle within these countries. The fact that Alpha-1 Global will be putting on a training webinar for patients on how to conduct advocacy on May 10th. We'll re-put the link for those people who may have joined after we put the link before. But it's essentially, we have a resource tool for patients who may be interested in doing advocacy and moving the needle and getting augmentation therapy reimbursed. Advocacy could take the many forms, from being a self-advocate, meaning you talk about your experience with the condition with your healthcare providers, with your friends, your family, anyone who will listen to you. That is being a self-advocate. And there are many other types of advocacy, all the way up to engaging with elected officials, as they've done in Belgium. It's quite a process. It can be kind of intimidating, but this resource is very valuable because it provides suggestions, tips, tools, and guides on how to do that. The other thing too is, patients are not on their own. If they need any help, any guidance, any suggestions, Alpha-1 Global is here to help you. Our resources are at your disposal. And so if there's anything that we can do to help, we will certainly do so. We do have materials in multiple languages that can help spread the word about Alpha-1 to your elected officials and your healthcare providers. So again, reach out to us. You can visit the Alpha-1 Global website. We'll put that in the chat for anyone to link to that. So there's many ways to do the advocacy, but in order to get augmentation therapy reimbursed in your countries, it's really going to take boots on the ground and activities at the local level to do so. But Alpha-1 Global is here to help you with the resources and the tools to do so. So please feel free to reach out to us.
Thank you very much, Randall. And once more, we put a link to research for the webinar that Randall just spoke about, advocacy webinar, in the chat of this webinar. Another question that we received from the audience, Ms. Matias, is when it comes to the current inequalities, when it comes to treatment. This is something that our speakers already mentioned earlier today. And indeed, the current, I would say it's current because the COVID pandemic still is ongoing, already increased many of the inequalities that already existed in Europe before the pandemic. But its effect was doubly felt by underprivileged rare disease patients indeed. So the question is, what are some of the steps that the EU should take to reduce these inequalities? And what are the tools that it can employ in order to guarantee all patients a better quality of life, irrespectively of their social background?
Thank you. Very briefly, yeah, it's true that we have been discussing the impact of the pandemic crisis, especially when it comes to most vulnerable groups. And of course, when we are talking about most vulnerable groups with rare diseases or dealing with rare diseases, is a double, triple, I don't know how to say it, impact. And we need to of course, to deal with this and to try to promote policies which not only try to now answer to these inequalities which were more increased, but also try to prevent inequalities. That would be a great step already. And it's not easy. How can we do it? At the European level, because of course there's a lot of things that can be done at national level. I think we are now working finally in the European social pillar, and it's quite important that we give prominence to the European social pillar because it deals with poverty, with inequalities, with access or unequal access to not only resources but also services and treatments and healthcare and all these dimensions which are quite important and should be part of the social and welfare states that we have in Europe, and then we specifically deal with it at different committees. One of the issues that we are now discussing in the new committee, which was created and implemented this week, the new special committee on COVID-19 pandemic. One of the things that we are trying to deal with is also to make an assessment of the different impacts and of the pandemic crisis and try to bring responses and solutions. And I think that this is one of the grounds where we have to work also when it comes to rare diseases, not only but also. And but unfortunately, I would say that some of these problems we can promote alliances and networks and recommendations, but some of these problems then are blocked at the implementation level in the national member states. So it's important that we keep working on this, but also it's very important that the advocacy which is made is also made directly at the member states and their governments in order that the implementation can be done properly. But I don't have the time. Of course, we can do, I can say a lot of more areas, but we don't have the time. I can answer by email if you want.
We'll be happy to hear more from your perspective. Indeed, the creation of the Special Committee on Cancer is already a great achievement in order to tackle the challenges that emerged during the pandemic. We also have one question to Mr. Santarella. Right now we have Ms. Matias in this panel discussion. You as a person who has a rich experience in leading different patient organizations and groups, what is something that you would like to communicate to policymakers such as Ms. Matias that we have here with us today, that is crucial for their work with patients, for improving quality of lives of those who live with rare diseases such as Alpha-1?
Sure. Well, first of all, she's obviously taken the first step, and we truly appreciate that, Matias, that you're here with us today, and your interest is obviously, and your enthusiasm for wanting to help us is very evident. So we truly appreciate that. I think collaboration amongst all stakeholders, including elected officials, is essential for progress and change to happen. I think we experience that in almost all aspects of life, but especially in rare diseases. I think each stakeholder, whether it's a patient, an elected official, an industry partner, a family member, in some ways we all have a responsibility to improve patient care, right? It's especially for those of us that are healthy. And I think for elected officials, there's some real benefit to improving care because it can help reduce healthcare costs, something that their constituents, will like to see. And it's a benefit to the whole, the entire healthcare system, whether it's, it's a socialized system or a more privatized system. Lower healthcare costs are always welcome. And I think for patients specifically, improving care will not only lead to better health and a quality of life, but it's something that I think we all can appreciate, especially we have family members that suffer from diseases. So elected officials like Ms. Matias and Ms. Wiseler-Lima, their leadership and voice is important, I would say almost crucial to rare disease patients because these patients are often overlooked. And as officials, they can give some weight and importance to these issues and truly have the ability to cause change based on their leadership and the way that they can actually operate within their governmental, policy environment. So, improving patient care affects all of us. Each of us has a role to play, and by working together, I have no doubt we can improve patient care to the benefit of all of us. And I think, forums like this today really help set the stage and allow us to begin to collaborate and have these conversations that will help us achieve, our goals, collectively. So proud to be a part of it. And, obviously Alpha-1 Foundation wants to play a larger role if we can, wherever we can to help, people all over the world dealing with these issues.
Thank you very much, Mr. Sottarella. Let's hope that next year we'll be able to gather together in the buildings of the European Parliament to have in-person discussion. And also it will be an opportunity to see each other for the first time for some of us. But with this, I think that we can conclude the open floor discussion. And I wanted to thank everyone who joined us today, who participated in the Q&A session, and especially specifically a huge thank you to our esteemed speakers. And right now, I would like to pass the floor to Ms. Matias for the concluding remarks.
Thank you again. So as you can see, my connection is much better now than it was in the beginning. I hope it keeps like that. So I want to thank you all. Basically, I want to thank you all and stress some of the concerns which were raised, and of course, that we pay attention to them. Unfortunately, we cannot do all we want to do, but we will work on that. And issues raised in all the interventions when it comes to the need to improve diagnosis, when it comes to the need to improve funds, also to reinforce the funding, especially to research and innovation, and to help to reinforce also the European networks, because we need to work together. It was also said, and these are important areas that we need to keep working. You know that in the last, I'm a member of the Parliament for 13 years now, and on the last two discussions on the European Union programs on research and innovation, we have always been committed to put as much as possible to support research on rare diseases and the funds to these areas of research. But also we need to think and to work and to legislate around the care, as it was just said now in the last intervention. So I want to tell you also, I'm very much engaged with informal carers. We know that, of course, there's a different and limited access to healthcare, to treatment, to all these dimensions, but we cannot also forget that 80% of the care normally is provided by informal carers, by family, friends, neighbors, and it's quite important that we also provide recognition and support to these carers. And now the European Commission has just launched a new European strategy for care and carers. So I would use just these 30 seconds remaining to invite you all to take part, to really address us as European Parliament, but also the national parliaments in three specific files. One is this European strategy for care. I think you have a huge contribution to provide, and it's important that your voice is heard. We are here, but also it's needed that it comes from those who are directly affected and can be more a better reference, I mean, for this area. A second area where I think that it's important your intervention and your contributions has to do with implementation of the Work-Life Balance Directive, which was just approved last year and is now being implemented in the different member states, because it has already some issues related with paid leave and things like that, which are needed sometimes for family members, and they need to be reinforced. And I think that in the case of the rare diseases is not so well covered, so it's just about recommendations, and it would be important to have binding implementation on these dimensions. Thirdly, your contributions to the new elected and constituted committee on COVID-19, as we already said several times. I think this is really, really important that in these files they are now being discussed and implemented, that all voices are heard. And I thank you very much. I learned a lot. I took a lot of notes, and I'll keep doing the work. I also have to make some research about European Lung Health Group. I didn't know, so I'm not a member of this group. And thank you all, and thank you especially Kinga and Anton and Alpha-1 Global. And let's keep in touch. Thank you so much.
Thank you.
Thank you very much. Thank you once more for everyone for joining the call, for joining the event. We'll be sending the report of the event in the coming weeks. So thank you once more, and I wish everyone a wonderful afternoon or the wonderful day for those who are based in the US.
Thank you.